Video number 2 of 3 in regards to women and creatine. This video is going to have some information regarding pregnancy. Yes, it's safe. And it will touch base on some mood, brain health, cognition, and a reminder that the third video is going to touch base on perimenopause and menopause.
Something to think about too is just the application, the mental component that happens during pregnancy and postpartum related to depression and anxiety. And there's some research I'll highlight here too that creatine supplementation may support that. But the research really supports there is very minimal risk and really only potential benefit, not only for you as the mother based on metabolic changes, but also for the child. Potential prophylactic use by supplementing as a mother and even nursing for the fetus. So 1 in 8 women experience more depression in their lifetime. It's twice the rate as men. That's significantly increased in perimenopause and very high prevalence postpartum. Women report more worry and cognitive variables associated worry with men. And so we're thinking about that cognitive connection. We also identify creatine supplementation supports increases in frontal lobe phosphocreatine levels. Women have reported to have lower creatine levels in the brain. After creatine supplementation in women, there is a significant increase in frontal lobe creatine levels that has been associated with greater changes in kind of feelings of depression or a reduction in depression. When combined with antidepressant use, there's even a potential better effect. So combining creatine or creatine supplementation in women that are already on some sort of SSRI. In a feeling or scenario when memory is reduced, creatine supplementation tends to improve memory. One key time point, again, being postpartum with that mom brain or fog. Creatine can be very effective. The idea of cognition and sleep. So it goes back to this idea that any brain activity results in a reduction of phosphocreatine to help maintain ATP. And so under periods of greater cognition and memory and attention, under sleep deprivation, that demand for ATP is elevated. There's strong data that suggests that women multitask more. We survive more on less sleep, whether that be because of child rearing or whatever it may be. I think there's application for women with creatine supplementation to support better memory related to how our brains work, as well as potential greater effects during sleep deprivation, which may happen during kind of perimenopause or even in the postpartum phase.